As the COVID-19 cases continue to rise in the country, we bring you this update. Today, to talk on these issues, I am joined by the Chief Coordinator in the Office of the President in Cabinet, Dr. Agnes Mahomva. Thank you for coming.
Thank you.
We are also joined by the United Nations Resident Coordinator, Ms. Maria Ribeiro. Thank you.
Thank you very much.
So, Dr. Mahomva, what are the figures saying this morning?
Thank you. Yesterday, we recorded a total of 4 new confirmed cases, giving us a total of 391 cases so far. Quite clearly, the numbers continue to go up. But as we always say, the public should not panic. We are very aware, we were aware that the numbers were going to continue going up. And so we just need to continue strengthening how we're working together, the whole of government, private sector, and I'm glad we have the UN also here to really support us and continue doing the work with us.
Okay. So, Doctor, we have noticed that most of the cases that we have today are as a result of the returning residents. Are there any measures that have been put to mitigate against this, or probably asking for health certificates when people are coming back?
Absolutely, and I'm glad you asked that question because we've been working flat out. When we noticed that the majority of the cases that we're confirming are really returning residents coming through our ports of entry, it became very clear that that's the area we need to focus on. And to do that, we ensure that we develop the integrated guidelines. I have a copy here that allow us to work together, the Ministry of Health, Labor and Social Welfare, who identify the quarantine facilities, law and order, who are there for security, so that we're not doing things in a silo, but we are really working together, ensuring that we're strengthening the management of those quarantine facilities. Yes, there's still lots of work to do. We still have some gaps here and there, challenges, but we can clearly see the improvements as we're moving on. This week, for example, we're doing trainings on those officers who are working in those quarantine facilities to ensure that they are following the guidelines properly. And of course, we're cascading the training all the way down to the provinces and so on. So yes, there's lots of work happening, lots of improvements, but we never forget and never forget to tell you that we still do have challenges, but we're working on them.
So the United Nations has been working with the Zimbabwean government for a long time. When it comes to this pandemic, what has the United Nations been doing to assist the government, just so the people know what you've been doing?
Well, I think one of the first things that the UN did here in Zimbabwe, as in other countries as well, was for WHO to work very closely with the Ministry of Health in the preparedness and planning to address the issues of the pandemic. Even though at the beginning the cases were few and far apart, we all knew that by looking at the way the pandemic is evolving in other countries, that Zimbabwe had to be ready and prepared for it. As Dr. Mahomva has pointed out, there are always gaps, there are challenges, and particularly in countries where there were already existing issues with public health services and challenges with public health services. So that's one. The second thing was to repurpose the UN programming in Zimbabwe. So, for example, the Global Fund, which has a major grant for Zimbabwe for TB, HIV/AIDS, and malaria, managed by UNDP, was able to reprogram some of its funding to ensure the essential supplies of PPE and other equipment to arrive in Zimbabwe quite quickly. And IOM has been working very closely on the returning migrants, and other agencies like UNICEF have also been looking at the question of the continuity of health services, which is essential in a situation like this.
Dr. Mahomva, have there been any improvements on the testing in quarantine centers on the stipulated days?
This is one of our biggest challenges, really. A lot of the challenges that we're seeing in our quarantine facilities have got to do with testing, and we have acknowledged and hear from the public out there, some returning residents coming in and really complaining that there are delays in testing, and so we took note of that, and we've actually basically said, moving forward, we need to prioritize the quarantine facilities so that we test more there and so on. So yes, there have been some improvement, but again, we still have a lot to do. We have been facing challenges with the actual test kits themselves, the quantities, but again, we have now mobilized resources. The Treasury has availed some monies, and a total of $5 million is now available, and the processes of getting additional kits is very much at an advanced stage. So moving forward, we see that markedly improving, but we will continue having some issues here and there. Quite clearly, this is a new issue. We didn't expect to have those large numbers coming back, us requiring a lot of quarantine facilities, but that's where we are. We always say, as we identify the challenges, we immediately address them so that we continue to improve. So yes, there has been some improvement moving forward.
Still on the issue of the quarantine centers, are there any measures that have been put in place by the task force to contain the virus in the quarantine centers?
Indeed, as I said, I think last week, and I continue to say that, we worked with all stakeholders, including the UN body, where we decided, instead of us just waiting for ministry to lead labor and social welfare to identify the facilities, security forces to come in security, we want to make sure it's integrated. We're working together, not in silos, and hence we developed the integrated guidelines. We are training on those guidelines to ensure that management of those quarantines is seamless. We're working together, and hence we are more efficient, more effective, and so on. So that's what we're doing, and that is what the task force has recommended.
Ms. Ribeiro, is there any hope of finding a cure? And in the event that the cure is found, are there any measures that will be put in place to make sure that it's accessible to developing countries like Zimbabwe in terms of cost?
Well, first of all, before talk about a cure, a potential cure, and I'm sure there's always hope for a potential cure, the emphasis has been on vaccinations, on developing a vaccine which could be addressed. And the Secretary General has been, together with other world leaders, has been very key in ensuring that the development of a vaccine is not just for those countries who can afford to buy it, but should be accessible to all people and all countries that need it. So there are several initiatives going on, both under the global initiative that the Secretary General is leading on, with the head of the WHO and other world leaders, but there are countries also who are supporting the development of vaccines. And I think that the whole question of equity and access has been very, very key in putting this forward. I cannot say when it's going to happen. I've understood that there are signs of good progress in some areas. We hope it will be soon. There's also been a lot of progress on cures, or perhaps not cures, but medicines or treatments which can alleviate and reduce morbidity and mortality in people most at risk with this. And I know that from discussions with Zimbabwe that they've been very keen on being part of that effort as well.
So, considering that you are working closely with the government of Zimbabwe, what are the recommendations that you have to the government towards the fight against the pandemic?
Let me start by, perhaps we forget that we see the numbers and we see the cases, and but even we're all, in some ways, we're all living in the pandemic at the moment. We're all affected by it, and in particular, when one looks at the whole question of lockdown and the measures, the public health measures that have to be taken in order, like social distancing, like not having crowds, that has an impact on people's lives. And when you have a country like Zimbabwe and other countries in the region where a large part of the population depends on the informal sector, people need to go and sell their tomatoes, their goods and all the rest. Lockdown makes it much more difficult. So it is one of the key areas, and I know that of concern, is to make sure that measures are taken so that people's livelihoods can continue in a safe way. And I know that some of our agencies have been working, for example, with the Ministry of Gender and SMEs at looking at how you can look at safe markets, for example, and things like that. The other, to remember also the ripple, the big impact is the effect on the economy, both at a macro and at a livelihoods level. So that needs to be addressed, and that's why it's important to look at efforts like developing the National Development Strategy, which takes into account the recovery. It's an opportunity for Zimbabwe to come back better and stronger. but that also means an all of government, but not just, it also means how to involve citizens in also providing some of the solutions, whether it's at a community level or at national. The last point is obviously lockdowns and special measures that have to be taken from a public health perspective also sort of put people under tension, under stress. We've seen an increase in gender-based calls to the hotlines on gender-based violence, also on the children's hotlines and things like that. So special care needs to be taken to protect those most at risk and most vulnerable to other aspects, and not to forget that the issues and the problems that existed in Zimbabwe and other countries before the pandemic continue. So issues of the impact of drought, of food insecurity, and that's why, for example, WFP has continued to its program, which reaches almost 3 million people a month, with the Ministry of Labour and Social Welfare and other bodies, to continue to deliver assistance to those most in need. We have to do business differently. It's not business as usual, but we need to continue to address comprehensively the issues that are at hand.
Thank you. So back to you, Dr. Mahomva, as we wrap this up. There have been concerns over the issue of the reopening of schools. What would be your recommendations as the general public gets ready for the reopening of schools?
I think it's the same recommendation that we give to all sectors, really, that if you are going to continue with your business, so whether it's education, whether it's commerce, industry, and so on, it's important that you put in place those measures that we continue to recommend. Have your people been tested? Is there social distancing in the schools, for example? Have you planned enough to make sure that the children, as they come back, those at the right ages are wearing masks, the teachers are doing the same, you are washing your hands with soap and water, you make sure in the schools you've got all those facilities. It is so critical for good, proper planning. And I know Ministry of Primary and Secondary Education have done that. They've got excellent plans, but it's not good enough to just have plans. They need to really continue consulting. And that is exactly what they have done. I know the Minister of Primary and Secondary Education, the whole of this last month and so on, with his team, they've been going around in schools, consulting, not just with the teachers, not just with the communities, but even with other associations that have a big say in education. That is critical. Remember, COVID is here to stay. We want to manage it, but it may never go away completely. Hence, we need to prepare for that new normal. We need to be able to go back to school, to do our businesses, but in a different way, in a new approach, as it were. So we cannot say we can't go to school. Of course, the planning, the timing has got to be right, and that is informed by the consultations and by proper planning.
Thank you very much, Dr. Mahomva, for joining us this morning, and thank you very much, Ms. Ribeiro, for joining us.